if you want to see the reality of what we're talking about, type in Maine overdose opiates and hit images on Google and see what pops up. And you're going to see page after page after page of young people, older people, crying parents, crying siblings.
People don't always remember what you say to them, but they'll always remember how you made them feel. And they remember that part of things. They remember that somebody is concerned about their safety. Because the fact of the matter is, by the time they get to our door, they've already pissed everybody off in their lives. So just having somebody, express, some sincerity that hey, we're glad you're here, means the world to them.
Medication-assisted treatment, MAT, is truly standard of care. It's very, very tempting, I think, for a lot of people to just prescribe Suboxone, but I would argue that that is not standard of care. And it's actually a disservice to our patients. They really need to be in psychosocial counseling, and it's worth the effort to find a good counselor to work with. A patient is not in treatment if they don't have the counseling piece.
So we started screening people, and we started doing the assessing for them. And, based on, DSM criteria, ASAM criteria, whether or not this was a person who was even appropriate for this type of treatment.
I think a lot of us in primary care are just getting sort of burned out. I think a lot of us are getting jaded. I think there's a lot of quality metrics. A lot of us are wondering what's happening to medicine. I can't even talk to my patients anymore without clicking buttons and doing all these quality metrics. We didn't receive training in either in medical school or in residency about how to work with addiction. And a lot of folks are kind of nervous about treating addiction without the expertise. I approach my opioid-dependent patients as if they have a chronic disease, because they do. We know that. We know that the brain is permanently changed from taking high-dose opiates. Permanently. It's not going to go away. If you have one person in your practice who's opioid-dependent, where you can provide them real help, you may literally save a life. You don't have to have a big, robust, crazy, 2-day, 3-day-a-week practice to seeing just Suboxone patients. You can easily just see 5 or less. The training that they're going to get through the online course is second to none. Okay, it really goes through what you need to know in order to be successful in this practice. Look at the literature, because there's good science behind this. It's not going to affect your productivity. It really won't. In fact, I would wage a bet that it'll actually improve your productivity numbers. It's incredibly professionally rewarding. Promise. If you've got an open mind, an open heart, probably the most important thing in my opinion is an open heart, have an open mind and good judgment with your medical expertise, you're going to be totally fine. Our job is easy because a good counselor will do all the heavy lifting for us. So when we get a patient, a new referral, all the hard work's been done. They've been diagnosed with an opioid use disorder. The treatment plan's kind of in place from the psychosocial standpoint. All patients, for at least the first 4 weeks, they see me weekly and they see the counselor weekly. Let's assume they don't need IOP. So we'll see them for a month. If they have appropriate urine drug screens, they're getting to the counseling sessions, they're getting to my appointments on time. Then after 4 weeks, things are going great. Then we'll see them every 2 weeks. We'll do that typically maybe for a month. Then if they're still doing well, then I'll see them once a month thereafter. There's never, ever any judgment in my office, ever. This is not a moral disorder. This is not a choice. When a doctor makes himself or herself available to the community to say, hey, this is what I'm doing, I could tell you from my personal standpoint here in Bridgton, I've had nothing but positive responses from folks. Our citizens, our neighbors, they desperately need us. They desperately need us. We need help. We need help from a lot of different people. I would say as a physician, I would like people to at least consider prescribing Suboxone. I think that we have a moral obligation to do that for our patients because, quite frankly, a lot of us prescribe these opiates that have led people to get addicted in the first place. It's time for us to get this out of the shadows. It's time for us to have an open discussion as a society about what's really going on. Kind of pull the rug up. Yep, it's ugly, it's dirty, it's gonna take a lot of work, but somebody's gotta do it. Where there's a will, there's a way. Like if we want to do this, we'll just figure it out. That's what we do. The patients I'm going to remember at the end of my career are going to be the patients I've treated in my Suboxone clinic. It is truly like being on hollow ground to sit there when a person is at their absolute depth of despair, desperate for help. They'll do anything. And you have a tool that you can provide them that allows them to change their life for the better, long term. It is an experience that is absolutely priceless.
You really get to see people like change, like their lives, like, and in what a person who might be what you would consider the most unlikely candidate, and the next thing you know, they're in school earning a degree. It is amazing.
This is a bigger problem than a doctor can fix. This is a bigger problem than a counselor can fix or the police can fix. It's a community problem. This is a social problem. And it's going to take people from all walks of life to really make an impact. There is nothing like this practice. You will sit down for 20 minutes and talk with a person whose life will be directly changed for the better for the rest of their lives. And it has a ripple effect. You're going to help their kids. You're going to help their parents, their brothers, their sisters, their employers. And you're sitting back and you're looking at it and you're like, all I did was prescribe Suboxone, right?
No, but if I may, that's not all you did, because so often one of the things that, patients say to me, I say, how'd it go with the doc? Like, how'd it go with Dr. Leighton? And so often with all of the physicians that we work with that prescribe, that client will say to me, I've never had a doctor talk to me like a real person, like they did.
Because guess what? They are real people.
It's amazing.
They are. They're real people. And I've told everybody around the state, I am at 647-2311. If you have a question about anything, give me a call.